Tēnā koutou katoa, ko Carlton Irving tōku ingo, he reo no te whakatohia me te upokore. I am the Director of Māori Health and Consumer for Tāhū, Hauora, the Health Quality and Safety Commission, and my name is Carlton Irving. By background, I'm a critical care paramedic who's recently retrained as a medical doctor, and I'm very passionate about equitable outcomes for Māori and vulnerable communities. Manaakitanga is really about respect, it's about care, and it's about hospitality, and it's really crucial in building trust with consumers and their whānau during vulnerable and uncertain times. And it's thinking about spiritual, emotional support, not just clinical care. It can help uncertainty by gathering comprehensive, holistic information about consumers, building better rapport with consumers and whānau, identifying subtle cues that might get missed in rushed consultations. And I think the big part is about offering reassurance, reducing anxiety, and fostering trust. When we're dealing with patients and whānau, what people want is not just for us to listen, but to feel heard. And sometimes that's about the way that we respond and interact in a way that creates a safe space. Often when we talk about cultural safety, what that means in practice is about creating a culture or a space that you're in where people feel safe to be who they are, where they are, in the space that they're in. Manaakitanga is really important in that, in understanding that patients are never just a pathology or a problem that needs to be solved. They are a person, and for them to feel acknowledged and valued in the conversations and consultations that we have in that way, I believe is an important part of bridging that gap of being safe culturally in our approaches to patients. I think navigating uncertainty is an important part of clinical practice and anyone's health journey, because there's so many variables and there's a process that has to be taken through. I think when we use manaaki in our approaches and we learn to listen and we listen to learn in our conversations with one another, we learn how to interact with patients in a way that they want to be interacted with. We find ways to ensure their comprehension. And similarly, we're allowing consumers to teach us how to treat them. And that's very important in that not only how we offer and render care, but how we interact, how we listen, how we learn, and then ultimately how we share information in a way that they understand. We offer clarity in periods of uncertainty. And where we can't offer immediate clarity, we give an understanding of the process. And that all comes off trust, which I think is anchored in our approach with manaakitanga. Well, they say good governance is multiple viewpoints, and I think where we create a space where anyone can share a viewpoint, then we can learn from that. We have to all consider positionality and power dynamics and relationships with peers. Where we are all equal, it makes it much easier to be listened to. But that's not necessarily the safest approach. The safest approach is that we can all listen, we can all learn, that we recognise that all voices are valued. And I think manaakitanga is really important in fostering that sense of safety, that ability for people to share what they see, what they know, and what they understand of a situation. And it creates clarity around what's happening. It creates security in understanding what it is we're sharing with one another. And most importantly, it makes sure that we keep the consumer in mind at all steps through the journey to make sure that we're offering the best possible outcome and the best possible experience at the same time for consumers in the health system. First and foremost, we have to think about how we form and build relationships with one another within the structures more broadly, and how we enact things like Te Māori Orongo, the Health Charter, and the values that expose us too as clinicians. And also we need to think about the code of expectations when it comes to engagement with consumers and whānau, both as clinicians but as consumers as well, to look at it and go, am I being engaged in a way that meets those values that are set forth in those particular documents? When we are at a point that there is a need to discuss things that may challenge the view of another, it's really important that we consider how we give a message and how that message is received. But most importantly, that it's done in a way that upholds the mana of all involved in the conversation. Every context will give you a different approach to this. But that is what the core of manaaki is thinking about upholding the mana of those around you. There'll be reasons that someone's come to a diagnosis, and they would have formed that view based on the knowledge, skills, experience, and information to hand. As more information comes to hand, we all need to have the humility to understand that where we were before and where we are now are not the same. And that has to be communicated to the consumer in a way that they understand, in a modality that works for them, and in that space that I talked of earlier, that all parties acknowledge one another and understand one another and respect one another. That's definitely something that in some cases we need to aspire to, and in some cases is regularly practiced. But that's what manaakitanga is about, and that's what showing manaaki in clinical practice should look like, that we listen to the patient, we listen to each other, and we share what we know with one another to allow the best possible outcomes for all involved. I don't think it's a stretch to say that as a clinical workforce at the moment, and as patients, there's long wait times, it's stressful, it's difficult, particularly in high stress environments and where people are really unwell and there's that level of uncertainty. Things become heightened. What I do in myself is I think about when I have something to say and I need to share. There's a beautiful moment between stimulus and response that I like to exploit, to consider what I'm going to say, how I'm going to say it, how it may be received, and allow myself that grace and space to always think about that. And then after I've had shared whatever it is that I've shared, it's important to just, again, create that space to make sure that it's received, it's understood, but most importantly, that it's received in the heart that it was shared with, and where it's not, be willing to be wrong, be willing to say sorry, be willing to acknowledge that I could do that better, and to learn from that interaction of how best to interact with that individual moving forward. And it's a continual iterative process in any circumstance. But that's what manaakitanga means to me, is to think about when I share something with others, how is it received? Most of my career was working in rescue helicopters. And I'm sure that a lot of people look at sort of the ambulance, paramedic, rescue helicopter space with a sense of it's about lights and sirens and racing around saving lives and hanging out of helicopters, and that might be the high points when someone looks back on a career in that space. But it's not. Some of the most important parts of my career have been holding the hand of a patient that's dying, or supporting someone who's just really scared in a time of need. And it's those human moments that as a clinician really sit with you, that really make it all worthwhile. It's not about the kind of high drama, high sort of adrenaline type of parts that people probably think. It's about that ability to connect with another person really in their time of need and being able to render assistance. And how you define that time of need is not necessarily on the severity of the injury that they have or the acuity of the illness that they've got. It's about that that ability to connect with someone when they really need someone to connect with them and help them feel better. And I think that that's what has carried me this far in this journey, and I think that's why I continue to do the type of work that I do and why I'm involved in the spaces that I'm involved in, because I think that the interpersonal human part of health is the best part, and certainly as a paramedic, without question, if you would ask any paramedic, what's the best part of your job, they'd all say, it's the cute little babies you get to deliver, it's the holding the hand of an elderly person who needed to be helped up off the floor because they've lost the strength to get themselves up by them alone now. And there's something really special about that, about manaaki within our workplace, that is often understated, and that joy of being able to help another human being, that purpose and meaning is, to me, without question, it's the best part of what we do. At its heart, manaakitanga is about being kind. And that's not a throwaway romanticisation of what we need to do, but I guess in essence my message is be kind to others and be kind to yourself.